Welcome to the Butterfly Effect. My name is Clive Enever. I'm a business strategist and I help people discover clarity to more easily engage with more of their ideal clients more often. I am also the presenter of podcasts Business Conversations with Clive Enever and Business Wisdom. I'm excited to be here today because this gives me the opportunity to have a conversation with Claire McCracken about her passions. I've known Claire for about 2.5 years, during which time she has educated me enormously on things to do with the disability sector. Among her passions is encouraging people to live better lives, to have the opportunity to achieve their vision of their best life. And that's motivated me to help Claire achieve her visions. So let's talk to Claire about her vision. Hello, Claire, and welcome to the Butterfly Effect.
Thank you, Clive. I'm glad that you could be here today because it gives me the opportunity to discuss in a more articulate way what it is I am thinking about and planning for.
Yes, indeed. And the things that you've alerted me to over the years, I noticed came out as, some of them came out as a part of the report from the 4.5-year and $600 million Royal Commission recently. So you were onto this quite early, Claire. How did you start out in the disability sector?
Well, quite by accident, really. It was sort of a little bit of good and bad fortune. I had assumed growing up in Adelaide that people with a disability lived a particular way. I knew a few. We had a special class at the primary school that I went to, so I had a view myself that I thought the rest of the world had. And then when I began working in disability, I was quite amazed, really, that it really wasn't anywhere near.
So was that amazed or shocked?
Horrified. Yeah, it was very distressing. And I think that's one of the things when 10,000 people give their stories to the Disability Royal Commission. And I think we knew this. We knew this when the NDIS came out.
What do you think it is about the NDIS not matching the needs of the disability sector?
I think that a couple of things happened. I think the states were in a position where they were paying more and more. I think there was a bureaucratic labyrinth where they didn't really know how much it was costing, and I think they didn't really want to know. And I think also that the block funding system wasn't very good and the attitudes weren't very good, and there was a lot of ideology. And the problem is ideology is a wonderful thing. Utopian ideals are fantastic, but there wasn't a lot of reality or practicality in that. And so I think we made the decision to deinstitutionalise. And so we popped people out into the community, and we didn't have the staff, and the staff didn't have the support network or the supervision, and they were taking on different roles. So the role changed. And so they ended up becoming a lot more isolated. And I think in that regard, if there isn't supervision, sometimes that's problematic as far as accountability. We've discussed a lot of things that need to happen, but we still need to deinstitutionalise. And we need to understand that this particular panopticon is something that it's beyond a building. We need to deinstitutionalise people with a disability too, as well as the support staff and the community and government. We have a Disability Discrimination Act, and we're looking at, one of the recommendations was to bring in disability rights, a Disability Rights Act, and a commissioner. And I think if we're not careful, for every dollar spent, it'll only be about 5 cents that goes to the participant, which is going to mean you have to spend a lot of dollars to then support that participant. So again, we need to be careful that we don't follow the ideology and forget about the reality. We can't build a house for everybody, and we can't put them all in and give them all $1 million in care.
You mentioned educating the community. I mentioned earlier that you'd educated me tremendously. When I was a lad, if you went to somebody's house where somebody wasn't quite right, as they used to say in those days,
Yeah.
you didn't see those people. They were sort of in a room somewhere that weren't there. So what do you think is the best way that we can educate the community at large that people with a disability are not frightening?
I think people are keen enough. I think they don't see enough. And so that's where integration is important. I think one of the biggest letdowns for me in taking people out has been not so much businesses and other people. You do get your people that, Neanderthals, but it's actually been government is not inclusive. Government is not accessible. It's not only not accessible for people with disability, it's not accessible for anybody who, if you're with Centrelink, if you don't have a computer, you're quite buggered. For older people, for people who may need, if you don't fit within the cookie cutter mould, then it's not accessible. So everything's becoming more individual focused or participant led or patient focused, but it still has to be affordable. The ideology is wonderful, but we just have to achieve that ideology. We can't do the same thing we were doing before. We must change the way we're doing it if we want that different result. And as I said, the biggest disappointment has been government, that healthcare is not accessible. I cannot find anywhere in South Australia to take somebody who's in a wheelchair to a bone density scan. For people in wheelchairs, to have obstetrics, gynecology, certain medical imaging, dentists. I think we've got 26 special dentists in the entire country. And yet they're talking about extending Medicare to allow dentistry for people with a disability. Well, if they all queue up to those 26 dentists, we'd be right. But generally what happens is they get referred into a hospital, and by the time they get there, it's bad enough they just rip them all out. I've had people write to me to say that the bus driver refused to put the ramp down, and somebody actually broke their leg and he drove off and left them there, and he would have died had it not been for somebody to help. I think people want to help. I just don't think they know enough about it or how to.
A lack of knowledge introduces fear to people's minds, and if we fear something, we try and stay away from it, don't we?
Well, yes, I think certainly becoming a multicultural country, we can see that with a lot of the people that have come to our country, who are as much the founders of the country of anyone else. I mean, it's the reason why we have a wine industry, and is the people that came here.
Yes, bringing all sorts of expertise and cultures makes a huge difference to
and people with
building our own,
disability have that as well. That there's a large untapped brain force there to use, but they've also been very much the leaders for human rights for the rest of us.
Yes. So if we look at inclusion in my simplified life, we had people who were hidden away. Then we had institutions, and we had institutions because the hiding away obviously wasn't working. We had the institutions. Now we've decided the institutions aren't a good thing, and we're moving people into the community simply by placing them in a house in a suburb somewhere. That doesn't seem to be working given the feedback that the Royal Commission had. What's an alternative way we might do this?
Well, first of all, there are several reasons why we didn't and don't have the workforce. Much of the workforce needs capacity building themselves. We didn't have any accessible housing to put them in. We have a massive housing shortage in this country. Then we built, tiny institutions where people didn't have a private space. They didn't have to choose who they lived with. They didn't get to choose their carer, and it was just, a house in the burbs. There you go in the community. In a community where, they're very much the square peg to the round hole. There's nowhere for them to be. It's not a lifeboat in the ocean. It's a home pod on Mars. You daren't go out of it because it would cost an absolute fortune. You need all this equipment and everything to compensate for the atmosphere. You have to fix those particular issues. You have to fix, how do we make housing affordable? It's not just, affordable housing isn't, this one's, we made it out of cardboard, so it's a bit cheaper. However, it's 50 grand a year to run it with electricity. Affordable housing is something that needs a bit bigger scope than that. And it needs to be in a place where we have access to community. One of the biggest things that's changed is the way we build communities. We build dormitory towns and suburbs, that are huge, and it's the same set of shops. It's just a template. Whereas, we used to, I'm from the north of England, and, people birthed each other's children, nursed each other's sick. We don't have that anymore. The NDIS do speak about informal supports, but then they put people with a disability in housing trust estates where perhaps you wouldn't want that particular person to be around somebody who's vulnerable. Perhaps it's not safe to encourage that, to offload that responsibility. The productivity report in South Australia, they did one of our state government, and it said that, they needed to keep certain institutions because we didn't have the workforce or the expertise. But they were not keen in any dimension to facilitate remedying that.
So building community, from what you've said, and if we look around, it's pretty easy to see, is a lot more than simply taking some people and putting them into a house in the suburbs. As you say, there's something of a cookie cutter arrangement there, a dormitory arrangement. You've got to build a culture around that. You have to introduce people who want to be in that area. So we need to introduce the whole thing. Now, you've spoken about the 5 pillars. In fact, you've written about the 5 pillars, which is very impressive, because there are 5 key things that we need to help disabled people with in order for them to integrate within our community. Do you want to give us a bit of a rundown on what those 5 pillars are?
So when looking at the things that are important for human life, and you look at Maslow's hierarchy of needs, the things we need, and it's commonly done with the pyramid, and you can relate that into care. And from that, at the bottom, you have your physiological needs. So in those physiological needs, you've got things like somebody needs a home, and they need to have care, sustainable, care that they can take for granted. You can't make any plans in life to get a job, to do, to go and see a friend if you can't guarantee you're going to even be out of bed. And that's just the reality of it. And so there needs to be lifelong housing. That's your home, that's yours for life. And there's not that luxury at this point in time. And they need to be able to have, there needs to be that for the whole of the sector, for the support staff as well. So there needs to be training excellence and apprenticeship in line with that. They're seeking to register them. So that one of the safeguards and the elephant in the room, if you like, are the support workers. I know that you're sent to one before you've left the previous client, and you're not given enough information to look after them. And if you are trained by the participant in favour of anything else, then you're bound to that participant, which removes your choice and control. And there's a lot of exploitation, and we have to look into, modern slavery there. We are literally importing people to exploit. So we have to, as part of that physiological, we have to consider things like palliative care and crisis care, because the care of last resort cannot continue to be the hospital, and it cannot be somewhere that ends up being the institution, whereas some people have this ideology, and the rest of them, they're way too, we can't possibly. I think everybody can. Everybody can, to some capacity or another, they can. And so the next level up on is safety and security. So obviously what we're looking at here is safeguarding, but we can do that within, I don't believe in guardianship under any circumstances. I believe in supported decision making, and I think that that's not something that you do where you're just making a decision. It's something you do constantly when you're working with somebody. You have to teach yourself as much as them, and in doing that, you enable them to make those decisions. They don't have access to some people don't have access to that information as we do. So in the morning you know what day it is because you can look at your watch, or you can look at the newspaper, you can look at the TV. Whereas, if nobody's plugged in your watch, if you can't reach the remote control and nobody went to get you the newspaper, the day is the day that I tell you it is. Which is an enormous amount of power.
You mentioned supported decision making in preference to guardianship. For those of us who are not familiar with this area, what does guardianship entail?
Oh, it can be done under an hour. Somebody who thinks, because it's not really determined who can do it. Ironically enough, that I don't believe that most support workers would be qualified enough to understand what capacity was. So in under an hour, there are two kinds. You can have public trustee, where they decide, well, you're not able to manage your money, or it can be, well, you're not able to make decisions. Whereas a guardian, in that particular situation, what you end up with is somebody who may run 50 to 60 clients. They're not a guardian as in we think of it, like a big lion that's there to protect us and all of this. No, they just decide you live there, those people will look after you. It's very, very arm's length.
So it's taking away choice from the individual involved.
It's entirely. It's deciding that person no longer has any kind of autonomy, personality, or anything themselves.
So, whereas supported decision making is supporting that individual to actually decide what's best for them.
Well, yes, and in some cases that may not be possible because they may be too ill. But if you've set it up from the beginning with that in mind, they've told you, we have advanced care directives at the moment. And so that's generally for somebody who's got, say, 6 months to live, they're terminal or something like that. Generally people do them then. And it's like, what measures do you want? Do not resuscitate, or I wouldn't be on life support, or don't give me oxygen, or whatever. But it's not really an appropriate documentation for someone with a disability. I'm very keen in our villages is that people have a life care directive. So when we've had these conversations, should they be poorly and not able to speak, we can still hear their voice.
Yes.
But we have to plan that. And then if you have a sociocracy made up from people with a disability, if they are stakeholders and not just co-design where roll them in, tick the box, ask them what they want, and then get them out and we'll make the decision. If they're stakeholders, if the government needs to speak to them as much as they need to speak to, say, the coal companies who seem, there are certain people who can get an audience, just like that,
So in reference to our 5 pillars, essentially we have to get the foundation right before we can start moving up towards people being able to actualise their vision of their best life.
If you haven't got anywhere to live, how are you going to manage? Well, I would like to study, or I want a job, or how on earth is that possible? It's not. Nobody can. You're never going to meet a homeless person on the street, who's, got it all sorted out. That without having a place to live, it's very hard to get a job or do anything. So you need a home. You need to have that stability. I think it's something that everyone should have a right to. And I think that once they have a home and a lifelong tenancy, a lot of SDA, they'll guarantee it for 5 years. I don't know whether at that point you're supposed to evaporate or what's supposed to happen, and then you might be in there by yourself, and then you might end up with 3 or 4 other people. They're not very good at putting the right people together, so you may be at risk from somebody else, and you don't have any privacy. So I'm not a big fan of that situation. Never was. Just like the guardianship, I don't think there's any need for it. I think that we'll certainly have a Bill of Rights ourselves anyway. And I've always looked to the United Nations human rights for people with a disability rather than the NDIS Code of Conduct. I think that it's lily-livered and weak. So also there are other things that we can do rather than the service provider going to a participant and saying, here is our service agreement, and they slip in things so they roll over or they can charge whatever they damn well please. So for people budgeting, that makes it very difficult to do. So we do participant-led contracts. You know, if it's participant focused, they say, well, you know, I'll permit you, you do this is the money, and you're meant to be finished by then. And I think that's more compliant with consumer law. Once you move on from in with that, then hopefully you're in a position then to reach out and have a life beyond managing the damn NDIS. And you can take your care for granted. You're supported. No one's going. You feel safe, and you've got a place. You're safe physically and psychologically safe. So then, once you've done that, you can broaden out your wings a little bit. So hence the butterfly. We go from being in the chrysalis and in the cocoon, the caterpillar, and then we grow into the butterfly. Once we get to that, we think about things like love and belonging. We come back to community. When we regard that our elderly are in institutions, they're basically waiting rooms for God, and that they don't get to, you know, if you're lucky, you might get a bit of trifle. And they're not all terrible. Of course, there are some lovely ones, but in the main, you know, people don't want to rush there too soon to get there. In having community and being able to have your family, the ideology of all of this disability stuff is quite often that it's very singular, whereas people do have children, they have spouses, they have parents that they want to feel connected with and be able to look after. Though the undercurrent is disability, you can wind in all these other things where it is an inclusive community, not just inclusive for the people with disability, but inclusive for them to bring in those people that are important to them. And it gives you the opportunity of sharing skills and creating barter systems for time. If you have people apprenticing through the community for work placement with support workers, and they are trained in sometimes in literacy is necessary, cooking is necessary, how to do washing is necessary, and certainly some of the other things that we're expected to do. Many don't have a driver's license, so there are a lot of other facets that need to be integrated in there, which are essential in order to keep insurance affordable, that we can actually have it. Otherwise, they'll whack the premiums up and not insure everybody. And then when it all blows up in their face, they won't need to pay out because, well, obviously it was negligent. You put somebody in the role knowing they weren't qualified for it. We have things called compassionate communities in Australia, and there's one in Wollonga, I believe, and it was a chap from England who started this, and they're just, you know, I suppose we may think of it as a hippie camp or something we've heard a lot. People would have heard the word kibbutz lately a lot, with it's talking about Israel. They're a community where people share expenses, they share their lives, and they help each other and exchange time and resources with each other. It's not a new idea. You know,
it's interesting that, as I recall my history learning, that's how we started as a species, isn't it? We shared, we were together. In fact, I remember
the success of the species.
I remember you telling me a story about the discovery of a pelvis at some stage, which the discoverer subsequently called Elvis for obvious reasons. But that pelvis told the archaeologists such an enormous amount of information. Would you like to relay that story, for example? Because I think that goes to community, doesn't it?
It goes to how people are valued in community. And it's certainly something that is, once people lived long enough that they could share information, that definitely enabled us to adapt, and it enabled us to cooperate with one another. But this gentleman had, quite a privileged position, Beryl, obviously was held in high esteem, and yet was quite disabled. And in our world today, got to an age that wasn't too bad for the afflictions that he carried. So obviously, this person was valued and
cared for by others,
and would have required extensive care. It is the marker of when we became civilised, and a lot of anthropologists have said so, that once you saw that people had a broken femur, the bigger bone up here, and they survived it because obviously they needed care. But you wouldn't want to lose your best hunter, or the one with the best stories, or the person that, perhaps you loved the most because that gave the rest of the family group a reason for living. It makes us feel, when we give compassion, it makes us immune from what they call carer fatigue. And this is scientifically proven. When we're able to give compassion, it prevents us from burning out.
It keeps us going, it motivates us and gives us a reason for being here.
Yeah, meaning in life is certainly something that we look for. When you consider we could have a creche where a lot of these support workers are female, a lot of them are single mums with kids, there's no reason we couldn't have participants assisting. We also have this conundrum where they want to close down the sheltered workshops. Yes. And so, they're highly subsidised. And they say, well, this would be terrible. So where are these people? Because obviously that's going to be a massive care cost. That they're going to lose their social life, their purpose, their sense of pride in self. So, but what we should be replacing it with is employment that is real. In order to do that, there are a few bridges we need to get across and gaps that need to be filled. And I think that we need to come down from the ideology and realise that institutionalisation is more than a building.
All of these things are all tied up in these 5 pillars where if we actually get that base right, we can move to the next level and address the issues there, each one leading people to a better quality of life.
They're things that we've known for a long time for every human being. We know that in order to get to transcendence or enlightenment, we're going to the top of the pyramid, an ideal place to be. It's not that I'm setting the bar that high, and it's not that many people, the rest of us have the opportunity to do that. Most of us are fighting to survive day to day. But when you have all those things in place, you'll have a sense of self-esteem. And once you're dealing in self-esteem is, it's about, love of nature, being able to be a part of nature, that appreciation. It's about beauty and mindfulness, and also about how you're able to present yourself and how you feel about yourself, and how you feel the rest of the world sees you. So these are things. There are many people with a disability that don't have that sense of self-identity. And then, hopefully when we've got a few things right like that, it enables us to determine care pathways for people and a plan where we're going. You have these people that have $1 million plan and their house is, probably quite condemnable. And I believe that most of the support workers have, very good Facebook accounts because they spend a hell of a lot of time on them. But they're not supervised or trained as to what capacity building is. They haven't got any clue. Either has the participant. That's why they're on the NDIS. There needs to be some guidance. There's no progression where we're going to. And this magical thing where, we would have a fully integrated, inclusive society. When we live in a country where women in a power wheelchair can't even get a pap smear.
As we move forward to build this inclusive community, you've come up with a plan to create a community right from the beginning, to introduce the services that all these people need, not creating an institution, but building a community which involves everybody in the community.
Well, it's a cultural change. People with a disability, their culture is nothing about us without us. I mean, obviously they're a part of it. One of the things the government looks at is the ever-increasing cost. Mm-hmm. If we had a Mary Poppins bucket of money that just kept going and going and going, well, wouldn't it all be wonderful for absolutely everybody? But the reality, it isn't. So we need to change the way that we're doing things. And it also, the charities have had, several hundred years to perfect this. And we haven't been able to get there. The first thing that happens is that the states need to pull their socks up, and the government needs to comply with the Disability Discrimination Act. If people are healthcare is looked after and accessible, then they're healthy. It's quite often the comorbidities and things that make the care cost so much anyway. But you can have, as I call it, healthability, so that you are the healthiest person with a disability that you can be, but we don't think about that because we write them off, not realising how much it actually costs us. If we do the same thing in care, by sharing resources, by creating a community based on those needs, for where we're all a part of that community, it enables people to integrate into the community. And it's a bridge to hopefully very different things in the future. But what it will provide is a way that it will stop it becoming, never mind 100 billion, it's likely to be 200 billion, especially if they ratify the UNCRPD into domestic law. Mm-hmm. That's going to, well, then if we're all entitled to a house, it's like, well, hey. So we need to find a pathway where we can realise that ideology with an outcome that you would want to live as a human being in this country. And I think there needs to be a degree of honesty and a degree of authenticity to be able to get there.
You mentioned state government working with federal government. I guess community starts right there. If they can't come together as a community, they're not going to build a community.
And they'll end up in the situation like they are with aged care, where they are in a very compromising situation, and they are forced into a corner by those providers who teeter on the brink of collapse and count out exactly the number of baked beans people get. It's an institution. It's a place to die, and it's very, very, very expensive for those people to go there, because the bureaucracy itself and the safeguarding and the this and the that, like you need to just simplify it and say, well, a lack of community is actually an issue. We haven't actually deinstitutionalized anything. We haven't correctly begun the process. It doesn't matter if we're not all in the same building. It's the same with the prison system, the army. People remain institutionalised even though they've left that particular system. We need to be able to deinstitutionalise not just the public, the rest of government, and people with a disability also.
Yes, so institutionalisation goes way beyond the building itself. It's all about how we think about it.
Well, we look after many in exactly the same routines and same rosters and care plans as if they were in the institution. And then they go, oh, why is it any different? I don't know.
So throwing out the old is not the same as building something new.
I think it's a necessary path, is to have taken that path. but to continue doing it and expecting a different outcome, it would be extremely unwise, because everybody will end up back in institutions and it won't be revisited again for a very long time.
Tell us about this vision you have for this village. How does the village look? How does it feel? How does it operate on a day-to-day basis? And is it restricted? Can an able-bodied person not be part of it, etc.?
Well, of course, because that's the point of sharing resources, isn't it? Mm. It might be somebody's spouse, it might be the support worker, it might be, their children, it might be their parents. Community and family. It does not consist of one single person with a disability shoved in a room. So of course it does.
Community, by the word itself, means coming together of various people.
Yes.
And the village you propose is somewhere that a disabled person will feel included, will be included. Is that how it works?
They're stakeholders, they're part of the system itself. They're determining it. Mm. So there will not be a need for guardianship as far as we were concerned. And it's based on, there used to be, there still are, King Charles is building a model village at the moment, mm-hmm. and to assist with some of his enterprises where, workers are taken care of with employment and health, and they join resources together. And it's the same as I said before, like a kibbutz, and we have these compassionate communities as well. If everybody has to be, an island themselves, it's going to be way too expensive, especially given the cost of living crisis and some of the things that we're facing in the world at the moment. Moral liability doesn't, outweigh the fact that we can't actually afford to uphold the United Nations Articles of Human Rights. Mm-hmm. Not everybody has shelter. Not everybody feels safe. And what we discovered from the Royal Commission is that that also 10,000 stories.
That's a lot of information in 10,000 stories.
And it's something that I think we should be ashamed of. But I was also very, very proud with the way that we actually accomplished that. Yes, it cost $600 million, but I think it was well worth it. I think not only myself, but there were a lot of people that were aware of many of the issues, but not in the one place.
Yes, that's right. Now that we have all of that information centralised and in front of government, there's an opportunity surely for government to make decisions which are positive towards the disabled community in helping them become part of the greater community.
I think that depends on whether they gain the support, whether too much power in creating, all these other people to come help change the light bulb doesn't diminish the ability to actually facilitate that. Mm-hmm. If we have committees for committees, and, I think we need to have a really big think about how that actually looks. And I think we need to, we did this thing in the offices where we changed the way management worked. We streamlined it. We made it very linear. Mm-hmm. And it just squashed it out flat, So we've got about, 10 organisations to complete the one task, and nobody at all is accountable. I think one of the things we do need to look at is the way that some of those institutions work, and maybe they need a bit of deinstitutionalising also.
Yeah, and of course that, as we've already discussed, the institutionalisation of things is more about how we go about it rather than the building itself. And presenting, again, the foundation in a way that gives people the opportunity to grow to whatever level they want to grow.
Well, yes, it's something that I hope becomes a legacy, and that we do develop as a society, and we don't measure care by, policies, Oh, it's, well, did you do this 5 times and have you got that? And have you got this document, that document? We actually, measure it by those outcomes in care, by the quality of the life lived.
Yeah. And in many cases, thus far in the last too many decades, many of the lives of the disabled have not had a good quality. Is that how it works?
I hear the same stories, housing that is not up to par, isolated, loneliness, lack of employment, the curse of low expectations. Unfortunately, that becomes something a bit like Pavlov's dogs, where they often, don't push themselves anymore as well. That's why self-esteem is important once you've got a home. When you have that self-esteem, we want more for ourselves. And they know what it is they want because they have something that they're working towards, whether it's micro-enterprise. I have a lass that's registered her own company and she's going to be a death doula. Her companion passed away. She wasn't happy the way with it was doing. And this was somebody that had become so immobile they barely left their room.
Right. So there's opportunities in all sorts of areas for people with a disability, just the same as there are for people who are able-bodied.
Well, there's no difference. It's hearts and minds. We have to change the hearts and minds of people. And I think if they can see that, these human rights things in a world that's becoming harder and harder with the cost of living and such things and nowhere to live, that those things will, actually filter out to others, that we all have a slightly better, fair crack at the whip, as is commonly said around these parts. And that enables everybody to have that opportunity. And I think that's something for people with a disability that they haven't had.
Yes, it's a terrible thing to take away the opportunity for somebody to live what they see as their best life. It diminishes, as you just pointed out, it diminishes the individual, it diminishes everybody around that individual.
They'll live the best life that somebody else has determined for them and not even know what they want for themselves. And people are, their best life might be that, their staff turn up and they got to eat something a bit more than, packet of chips that day. It's something that we will certainly have opened Pandora's box, but that will have been a good thing. That would be an essential thing, because it might remind everybody that, we're actually supposed to be going in a forward direction beyond, the percentage of every economic growth every quarter. We're supposed to be developing as a species.
Yeah, and helping each other grow to live that better life.
So to do that, we need to change the way that we've been doing things. We need to deinstitutionalise. We need to make sure that people have access. You can't just, people use the word segregation, but it's something like saying, well, okay, it's all open to you there and it's all water and you don't know how to swim or you don't have a boat. It's something that because it requires somebody else to assist, then we all need to take it on board. Rumi said that when he was young and brave, he wanted to change the world, and when he got old and wise, he wanted to change himself.
Yes.
And I think we all just need to do that and put a little kindness back out there. And I think we've forgotten, and I think a lot of us do know what it's been like for people. We do know what it's like, and I think we're so busy trying to survive ourselves. We say we don't have time. I think it's actually the only true currency we really have.
Indeed, time is the essence of everything, isn't it? We need to make time for the things which allow us to grow rather than chasing a dollar, for example.
Exactly. So as much as in reality we cannot spend in the current things the way things are anyway, and will be for, certainly past probably my grandchildren's lifetime. In the system that we have, we cannot afford to spend an unlimited amount of money. So we have to make people with a disability stakeholders, and we need to enable them to be in the workforce, to live to actualise their visions for what the life that they want to lead. And we need to do it in a setting and in a way that is affordable, sustainable, and makes the industry sustainable. At the moment, the average profit is, 2%, and the huge amounts of providers are going bankrupt. So, the elephant in the room here is if there's nobody to provide the care, it's a bit of a moot point. The provider of last resort will be the only provider. Apart from the big, institutions that look after our elderly, they've got room. So changing the model, changing the process and the way that we provide that care is, to me, absolutely essential. And I think providers need to be, well, a lot of us are taking on a lot of on board. We're doing a lot to help and giving a lot, and it's sending many of us bankrupt. But I think what we can do is really look at it and be brave enough to make those changes. And that's what I believe I've done.
Yes, I think you've done an excellent job in putting forward your proposals so that the whole community can come together and provide better opportunities for people with a disability to live that better life. Because some of the stories that came out in that Royal Commission, they're just terribly frightening.
They are, and you wouldn't believe that, we could normalise it, or that people, they're not criminalised, they'll get a little fine. And it's nonsense, really. We're very good at doing these reports. We're very good at creating legislation. We're not very good at enforcing it and making people accountable. That's something that doesn't happen. So hopefully what will happen is that these different models, of which mine isn't the only one, and I hope not, are adapted.
As always, Claire, you're so informative. You provide me with such tremendous information in this area. And whilst I'm not so passionate as you, I'm certainly becoming far more passionate than I was before I met you. So let's all get behind Claire and push for her ideas to get pushed forward. Bring this passion out so that the whole community can come together and support everybody, not just, I like that one, I don't like that one. Let's support everybody. Claire, where can people find you to help in this regard?
At carersandadvocates.com, or they can call 1800 422 228.
And can we find you on Facebook?
Yeah, if you type in Carers and Advocates, I'll come on in there, and I put most of the podcasts and things up there, and also if at Carers and Advocates on YouTube.
There you go. Claire, this has been absolutely wonderful having this conversation. Thank you for your time, and everybody out there, get behind Claire.
Thank you. Come with me to a village, a place where we empower, inspire and enable people to actualise their vision of their best life. We offer a village sanctuary that frees people from the burden of day-to-day care so that they can focus on their life's potential. We are an inclusive village, a community rather than an institutional home. Our skilled carers and progressive contemporary culture foster a reciprocal atmosphere in which all feel safe and empowered. We look beyond simply providing consistent care. Our passion is to liberate people from fear and uncertainty and inspire them to live their best life as valued members of the community.